Welcome. It is Friday, 12 p.m. Eastern Time. It is time for Ask Dr. Geier Live, wherever you're watching. Hope you're making today your masterpiece. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I hope you feel, look, and perform your best regardless of age or injury. I hope wherever you are, it is better weather than here. It is cold, or at least what's cold for us here in Charleston, and rainy. So I am looking forward to that changing a little bit, but that's okay. It's Friday, and that's a good thing. I hope wherever you are, I hope the weather is great, and I hope you're going to have a great weekend. This is your time to ask your orthopedic questions: injuries, surgeries, recovery, rehab, just what an injury is. If the doctor told you something you don't understand what he or she said, that's what this is for. I will stay as long as there are questions. Please remember though, I am not giving you specific medical advice. This is meant for general information only. I have not seen you, I haven't examined you, I haven't looked at x-rays, MRIs, any of that. I'm not your doctor, you're not my patient, so I am not giving you medical advice. Hopefully though, this information will help you understand that injury and maybe make a decision that's good for you. Understand that injury so you can go to your doctor and say, well, what about this? Or understand what that doctor's saying for what that's worth. I'll mention this again at the end too. I just want to say right off the bat, we are looking for 5 patients with knee pain who want to get significantly better in the next 30 days. If that's you, click the link below, fill out the little contact form and say, I have knee pain or something like that. I get those personally, and I'll tell you a little bit more. I'll talk about that at the end. All right, Georgia, good to see you. Still having this problem. I just updated my eCam, and we're still having this problem with the comments on the screen. I don't know. Sorry, George. It's good to see you. I hope everything's going well in Greece. Of course, Lucifer's works. No idea why I can get his on the screen, but Georgia, there we got Georgia. Georgia says hello. All right, Mary, who has been here a fair number of times. What can we do to keep our bones strong as we age, especially in our 70s? That is a terrific question. And I'll tell you, Mary, that is a question not nearly enough older adults consider. It is very, very important. And I know I'm going to answer your question, but I just want to say this. As you get older, if those bones get weaker and you suffer a fracture related to osteoporosis, typically that's either the hip, the wrist, the distal radius, or in your spine, that can lead to a significant impairment of quality of life. Just for instance, if you have a hip fracture in your older ages, you are, and I forget, I may have this backwards, but women within 50% of the time aren't able to walk a year later. Men, 50% of the time a year later, are dead. So you want to avoid that. Yes, surgeries have gotten better and all that, but you want to avoid that. Things that I tell my patients to do. Now, fortunately, my practice, people are really active and care about their health, so I don't have to have too much education about this. But one, regular testing for bone density to see where you stand. Sometimes it's a little more than supplements can do, and sometimes that's where you get into medications. But I would want to know a DEXA scan to identify low bone mass. I would do weight-bearing exercise on a regular basis. Walking, running, certainly good, but I would also do weights, build up the muscles around those bones, can be very important for bone density. And then I would consider supplements, at least at a minimum, magnesium and vitamin D, maybe calcium as well, can be very, very important. There's a number of other things that, giving up sugar, caffeine lowers bone density and causes bone loss. I mean, when I studied for my 3rd board certification in anti-aging and regenerative medicine, I remember the osteoporosis section. There were like 30 things that increase your risk of bone loss. So I mean, there's a lot, but that's where I would start. All right. Good question, though. I appreciate that. Lucifer says, it is just not meant to be with my on-screen questions. I've got an elbow injury 1 month ago. Fantastic. Not fantastic that you had an injury, but I'd love to hear about it and hopefully answer it. So, Lucifer, tell me about your elbow injury and what I can answer for you. Nurse Seda, would taking BPC 157 help to heal a ligament rupture that occurred more than 1 year ago? And then do I have any other recommendations in addition to physiotherapy on how to accelerate ligament rupture healing. That's a little tricky without knowing specifically what ligament it is. As for BPC, and I say talk about BPC and other peptides, talk about medications like penisin polysulfate, talk about exosomes and PRP. In my opinion, with a lot of these, any one thing isn't always going to be the magic bullet. Do I think some of these help? Absolutely. That's why I talk about them. But having said that, I like to offer sort of a combination of treatments and approach the problem from different angles. So rarely will I give somebody just BPC or just penisin or just do an exosome shot, because I feel like you're only tackling one part of the problem. It's a puzzle and you have to put all the pieces together. Having said that, there are studies that show that BPC does help tendon and ligament healing. There's rat studies where they basically cut in half the Achilles tendon of rats, sewed it back up with the tendon still ruptured, gave them BPC, and over time it completely healed. So it definitely can help. Now, those are acute ruptures. I have not seen any studies on chronic ruptures. Do I feel it would help? Potentially. And would I potentially take it myself if I had that? Yeah, I probably would take it. I will tell you that from what I gather, the oral form of BPC, which BPC is one of the few peptides that actually is well absorbed orally, but it does not seem, again, in my opinion, it does not seem to work as well for bone, joint, tendon, ligament, muscle injuries taken as a capsule as it does the injectable form injected near to the site of injury. Just, again, my experience. We can't prove that because, again, we haven't had enough data to really show it. But do I think it would be helpful? As far as other things to get it to heal, it really, again, that gets to what the ligament is. Some ligaments are very likely to heal. Some are very prone not to heal. So I don't know. Again, without knowing the type, it would be, would it be bracing? Would it be some kind of injection into the joint? That is a lot harder to say. Big fan of physical therapy, though. I do like that. Lucifer's elbow pains when I freely expand my hand. I don't know. I would love, this is one of those that since I'm not your doctor, I can't examine you. I don't have a great sense of what's going on, where it hurts, how it happened, anything like that. So she is saying ATFL injury. So that is the anterior talofibular ligament. That is in the ankle. That's the most commonly injured ligament in a lateral ankle sprain where you roll your ankle. Very, very, very often that heals on its own. So I partly would want to know why that didn't heal. But if it truly hasn't healed, yeah, you could try BPC, but typically if it didn't heal a year out and somebody's still symptomatic, they're having recurrent ankle sprains, then that's where the foot and ankle surgeons, the orthopedic surgeons that specialize in foot and ankle, will reconstruct that ligament, the modified Brostrom surgeries and things like that, where they use a ligament to basically, or a tendon to basically recreate the ATFL. So not saying absolutely you'd need surgery, there's a lot to it, but that's kind of what you think about. All right, Ahmad. Good evening. Donna. All right, go ahead and ask because you're last right now. And if it's real long, I will say that I can't read real long questions. So if you got a short question, Ahmad, I can answer it, but I can't get paragraphs up here. I don't have the ability to read that. And to be honest, that's not what this show is. Why do some people smoke well into their 90s? I don't know, because I feel like people know now. I feel like in the 50s, you could argue, hey, I don't know the risk of smoking. Maybe into the 70s. Now we know. I would honestly say it's a habitual thing that they just can't break. The physical addiction to the nicotine, the habitual addiction of putting something in your mouth and it gets tied to certain times of the day or certain stresses, things like that. I think that's why it gets really hard. Kustrom, I apologize if I said that wrong. I appreciate that. Loves the content. Meniscus root repair, OCD2 grade 2, on the femoral condyle. How long does the pain last? So I don't know where you are in terms of the surgery and what they had to do to the osteochondral defect lesion. If it was stable and they just saw it and didn't have to do anything, that changes it. Meniscal repairs typically take about 3 months just for the meniscus to fully repair, but it can be about 5 to 6 months before things like running even closely get back to normal. Those surgeries work well, but it is a long process. And then as far as the osteochondral defect, it just depends on, is there a exposed bone or anything like that. So tell me real quickly, Ahmad, about your ACL reconstruction question. If there's a 1-2 sentence summary of that. Like I said, while he's doing that, and I guess that will be our last question. Like I said earlier, if you have knee pain, our practice, we're looking for 5 patients with knee pain that want to get significantly better in the next 30 days. There's a link in the description below that will take you to the contact page of my website. Just fill that out, name, email, phone number, and then just put something in the description about I have knee pains, anything like that. And we will get back to you, my assistant or I will get back to you and talk to you about what potentially that could entail. So if you're intrigued, we want to help. So definitely go to that link below. All right, what is my opinion of orthopedic chiropractors? Yeah, I don't know that there is such a thing as orthopedic specifically. Maybe there are. When I worked with pro sports teams in my fellowship, the St. Louis Cardinals and St. Louis Rams had chiropractors affiliated with those teams. When I was the doctor here of the pro soccer team, which I did that for 6 years, the pro soccer team here in Charleston, we had a team chiropractor. Good people, and I think for a lot of different fairly minor, say like non-neurologic low back pain, I feel like that as a first treatment, not necessarily a bad thing. I feel like it's worth a try. Where I have concerns with chiropractors, and not all of them, just some, is twofold. One, somebody's been going a year and it's still not getting better and they just keep being brought back. I feel like if you're not getting better relatively quickly, it may be time to go see what the cause of the problem is. You go to somebody that gets real x-rays and interprets them, or MRIs if you need it. So that's one. And two, I've seen a lot of treatments for things that, abdominal pain, and they do manipulations and things like that. Again, I didn't go to chiropractic school, but I think most people in medicine, most physicians would say some of that is a little far-fetched. But again, a lot of the chiropractors I know don't. They kind of stick to what they do, neck and back and manipulations, and I think that's fine. So I have no issue with it. All right, Morgan, hit me up. You're going to be last today. Yeah. What is your question? Let's see if Morgan responds. While that's going on, please, if you want to subscribe to this channel, I would greatly appreciate it. If you're watching on Facebook or Twitter, definitely follow me there. But YouTube is where I do most of my stuff. I am going to start rolling out Instagram and maybe TikTok content. I don't know how much of that'll be live. We're still sort of toying around with Instagram Live. It's been a little bit more challenging than I expected, but those kinds of things are coming. So definitely, if you're on YouTube, click the bell to be notified when I start a live stream, and it tells you when I release a new video. Humerus fracture 1.5 years ago, functional non-union. Yeah, that's a really tricky problem. She says full movement strength at 75%, no surgery. Yeah, again, I don't want to... I'm not giving you advice because I haven't seen the x-rays or been involved in this. Typically, though, humeral shaft, the mid part of the humerus, if it didn't heal, it almost always is going to need surgery to get it to heal. There's just too much motion in that bone because of shoulder motion and elbow motion that wouldn't heal. Maybe there's something different in your case. I know sometimes they can try bone stimulators, but things like physical therapy, and typically none of that works. You have to stabilize the fracture enough that then your body can heal it, in my experience. Yeah, and that she's basically saying bones at an angle, but the healing stopped. Yeah, I'd at least consider, and again, not medical advice, seeing an orthopedic trauma surgeon and seeing if there's something that can be done. All right, that is all I've got for you. I hope you have a fantastic rest of your week. I will see, or weekend and week. I hope you have a great time. I want to give a quick, let's just say, good luck to, I'm the team doctor of a middle school, ironically, dance team that is competing for the national championship this weekend in Orlando. They've won it twice. I hope that this year will be year 3, and but lots of competition and more teams enter every year, but I'm really pulling for them. I'll be watching. It's on varsity TV, but good luck to the Christ Our King Stella Maris Crusaderettes. I hope that goes fantastic this weekend down in Orlando. Thank you so much for watching, for joining, for asking questions. It really makes me happy. I'm so grateful for all of you. Tell your friends if they have any questions. Friday, 12 p.m. Eastern Time. Have a wonderful weekend. Take care.